How would you report the right ventricular systolic function in this CMR image? Well, the correct answer is D. The right ventricular systolic function is severely impaired. Let's take another look. So this is a true axial view of the right ventricle. It's a slightly unusual view that we use occasionally to make it slightly easier for us to measure right ventricular volumes. When we perform a short axis stack, which is what we traditionally use to measure left and right ventricular volumes, it can be difficult to determine from that where the right ventricle ends and where the right atrium begins. The area around the tricuspid valve can be quite tricky to distinguish. In the true axial view, which is basically a transverse view through the patient's chest, rather like we get with the HASTE images, in a true axial view, it's a little easier to work out where the tricuspid valve is and to measure the endocardium around the right ventricle by drawing a line around it to delineate right ventricular volumes in diastole and systole. So this is a true axial view of the right heart. We have the right ventricle here, we have the right atrium here, and the tricuspid valve in between.